Hi, I'm Gil Welch. In this short take, we're going to talk about converting ratios to percentage change. We love ratio measures in medicine. We have relative risks, we have relative rates, we have hazard ratios, we have standardized mortality ratios, we have odds ratios. All these sort of are the same thing. There's something about an event frequency in the group of interest over the event frequency in the comparison group. It's a ratio. Now you might say, what's an event frequency? Well, the most familiar measure of event frequency is a probability. So it might be something like this: a probability of heart attack in the group of interest relative to the probability of heart attack in the comparison group, or the probability of cancer in the group of interest relative to the probability of cancer in the comparison group, or the probability of hip fracture in the group of interest relative to the probability of hip fracture in the comparison group, or the probability of death in the group of interest relative to the probability of death in the comparison group. The generic form is the probability of the event in one group relative to the probability of the event in another. And sometimes we use the language the probability of an outcome in the group of interest relative to the probability of outcome in the comparison group. Well, that equals some x over y. Each of those are quantifiable, and that makes it a ratio. Now, let's just say that ratio equals 1. What does a ratio of 1 mean? Well, it means that the probability is the same in both groups. Now, what if the ratio was greater than 1? What does a ratio greater than 1 mean? It means that the probability is higher in the group of interest than in the comparison group. What about if the ratio is less than 1? What does a ratio of less than 1 mean? It means that the probability is lower in the group of interest than in the comparison group. Now, because quantifying the probability of an outcome may involve unfamiliar terms, something like the probability of heart attack is 2.5 per thousand over the next 5 years. That gets kind of unfamiliar. Let's work with a more familiar quantity. Money. I like money. And we'll talk about my retirement account balance now relative to my retirement account balance in the year 2000. Now, that's also going to be some number over another number, which will be a ratio. And a ratio of 1 means my balance has stayed the same. A ratio of greater than 1 means my current balance is higher than my 2000 balance. That's good. A ratio of less than 1 means my current balance is lower than my 2000 balance. That's bad. Well, let's put some numbers to this. Let's say my retirement account balance now is $8,000, while in the year 2000 it was $10,000. That leads to a ratio of 0.8. What percent of my money have I lost? Well, I've lost $2,000. That's $10,000 minus $8,000. And I lost that $2,000 from $10,000. So $2,000 over $10,000 equals 0.2, or 20%. I've lost 20% of my money. But that information is contained in this ratio of 0.8. 0.8 always means that the numerator is 20% smaller than the denominator. What's the algebra? 1 minus 0.8 equals 0.2 equals 20%. Well, let's do another one. Let's say my retirement account balance now is $6,500. Are you kidding me? Oh, This is bad news. Okay, well, the ratio is 0.65. What percent of my money have I lost? It's not going to be pretty. I lost $3,500. That's 10,000 minus 6,500 from 10,000. So that's 3,500 over 10,000. That equals 0.35 or 35%. But that information is contained in this ratio. A ratio of 0.65 always means that the numerator is 35% smaller than the denominator. What's the algebra? 1 minus 0.65 equals 0.35 equals 35%. What's the general lesson? Well, the general lesson is for ratios less than 1, the percentage decrease, numerator relative to the denominator, is 1 minus the ratio. These examples have been pretty painful for me. Okay, if I make some money, let's say my retirement account balance now is $11,000. While my retirement account balance in 2000 was $10,000. That leads to a ratio of 1.1. What's my percentage gain? Well, I gained $1,000 from $10,000, and 1,000 over 10,000 is 0.1 or 10%. But that information is contained in this ratio. A ratio of 1.1 always means that the numerator is 10% larger than the denominator. What's the algebra? 1.1 minus 1 equals 0.1 equals 10%. Let's say my retirement account balance now is $12,500, while my retirement account balance in 2000 was $10,000. The ratio now is 1.25. What's my percentage gain? Well, I gained $2,500 from 10,000, so 2,500 over 10,000 equals 0.25 or 25%. But that information is contained in this ratio. A ratio of 1.25 always means that the numerator is 25% larger than the denominator. What's the algebra? 1.25 minus 1 equals 0.25 or 25%. What's the general lesson? For ratios greater than 1, the percent increase, numerator relative to the denominator, is the ratio minus 1. Now note the subtle difference. Here's a little table. Ratio, the direction, numerator relative to the denominator, and the percentage change. If the ratio is less than 1, that means the numerator is decreased relative to the denominator. The percentage change will be 1 minus the ratio, and that will be a percentage decrease. If the ratio is greater than 1, that means the numerator is increased relative to the denominator, and the percentage change is the ratio minus 1. Okay, is it okay if I really make some money now? Let's try that. So my retirement balance now is $30,000 versus $10,000 in 2000. The ratio is 3.0. This is really good news. What's my percentage gain? It's 3 minus 1, or 2.0, which is 200% increase. Wow. But that has a way of confusing people. Once you get over 100% increase, it has a way of confusing people. Wouldn't it just be simple, more understandable if I simply said I tripled my money? Sure it would. Ooh, now I got $80,000 off a 2000 balance of $10,000, a ratio of 8. What's my percentage gain? 8 minus 1 equals 7, a 700% increase. Wouldn't it be more understandable if I simply said my account increased 8-fold? I think so. Where does that leave us? Well, that means we have to break down a little bit what happens for ratios over 1. For ratios that are greater than 1 but less than 2, stick with that ratio minus 1 as a percentage increase. But when you have ratios greater than 2, you've got a really big increase. And forget the percent change. Go times as high, 2 times as high, 3 times as high, 10 times as high. How does this all play out in medicine? Well, I'll give you a finding. RR equals 0.9 for heart attacks following aspirin versus placebo. How would that be expressed as a percent change? It'd be expressed as saying patients taking an aspirin have a 10% decreased risk of a heart attack. 1 minus 0.9 equals 0.1, or a 10% decrease. How about an RR of 1.3 for breast cancer in women with early versus late menarche? That means women with early menarche have a 30% increased risk of breast cancer relative to those with late menarche. Where did I get the 30%? It's 1.3 minus 1 equals 0.3, or 30%. And here's one, RR of 20 for lung cancer in smokers versus non-smokers. Would we say a 1900% increase? I don't think so. We'd say smokers have 20 times the risk of lung cancer as non-smokers. Now, before I leave, I want to be clear that expressions of relative change like these tend to exaggerate both the perception of risk and the perception of benefit. So you should not take this video as suggesting that you always use percentage change. I just want you to know how it's done and how to interpret it. It can be very misleading. That's a topic for another day. What you should know now is that medicine is full of ratio measures, so it's important that you understand them. Big ratios, 2, 3, 10, they're easy, although we don't see them that often. The numerator is double, triple, 10 times the denominator. Ratios near 1 take a little more work. A ratio of 1.25 means the numerator is 25% higher. That's 1 minus the ratio. A ratio of 0.75 means the numerator is 25% lower. That's the ratio minus 1. Well, that's it. I'm done. You're done.